a great pleasure to welcome you all to this Manogna series of mental health awareness programs, which is an initiative of MAA ENT Hospital in collaboration with Rotary Club of Lake District Moinabad. So we all know that mental health is just as important as physical health because it influences how we feel, how we act in our daily lives, right? So it also helps us to handle our stress and other related problems. So Manogna was created with a vision to promote mental well-being, reduce stigma, and create a safe and supportive environment for people of all ages, be it children, students, caregivers, or professionals altogether. So we are conducting interactive sessions, workshops, and also a lot of community activities to equip individuals with all the practical tools that will help them. So as a part of this series, today's focus is on a very critical issue, that is suicide prevention awareness. So every year, World Suicide Prevention Week is observed in the second week of September and throughout the month, as I came to know just now. And this global campaign is led by the International Association for Suicide Prevention and World Health Organization. It is dedicated to raising awareness, breaking stigma, and spreading hope. But why is suicide prevention so important? When I was going through the whole thing, why suicide prevention, why are we giving so much importance? I just read through and I was discussing with Bona also that every 40 seconds, one person dies by suicide. So which is a very big public health concern. Behind each person who dies, a family, a society is affected. A story of pain that could have been changed if we had provided timely support. So it not only affects individuals, but leaves a lasting impact on families, community, and society worldwide. So the truth is, these can be preventable. Small things that we do will help us to prevent them. So we have to understand, recognize the warning signs. So this day, we have amongst us all the Rotarians who have been with us throughout to conduct such Manogna programs. Our beloved Sunita ma'am. And I have a pleasure now to introduce our esteemed speaker, Miss Bona Colaco. She's a clinical psychologist licensed in India with over 15 years of experience in counseling and psychotherapy. She holds master's degree in general psychology from OU and an MPhil in clinical psychology from Swikar Academy of Rehabilitation Sciences. She has also completed basic and advanced counseling skill training from the Hyderabad Academy of Psychology. Her clinical journey spans work in academic and community mental health settings across India and the United States. In India, she has conducted trainings on suicide prevention, stress management, and study skills, while also offering individual psychotherapy and supervision. She served as a faculty member and supervisor at the Hyderabad Academy of Psychology. After moving to US in 2015, she earned her second master's degree in counseling. And she was a part of research project at Stanford University focused on internet-based mental health intervention for college students. So her clinical experience includes working at community health awareness councils, as a school counselor, as a psychotherapist for children, adolescents, couples, and families. Currently, she is based in Hyderabad and maintains a private practice offering psychotherapy for individuals, couples, adolescents, and children. She specializes in women's mental health mainly. She continues her work as a faculty and clinical supervisor at Hyderabad Academy of Psychology, supporting all the therapists in training through teaching and supervision. She is also a consultant clinical psychologist at Cloud9 Hospital, Banjara Hills, Hyderabad. With this introduction, I welcome you all to today's program, and I take this opportunity to warmly invite our esteemed speaker, Ms. Bona Colaco, to take the session forward.
Good afternoon, everyone. Okay, I'll just give you a very brief introduction of myself क्योंकि इतना लंबा सुन लिए सब लोग, right? Thank you for patiently listening to all of that. So I'm Bona Colaco. I'm a licensed clinical psychologist, and I work primarily for the last 15 years with Hyderabad Academy of Psychology. I also am at Roshni once a week, and then we have been doing suicide prevention trainings for the last 15 years, every year, specifically in the month of September, because September is Suicide Prevention Month. All right, and so a lot of my training and experience of doing suicide prevention comes from the Hyderabad Academy of Psychology. So I just want to acknowledge that a lot of what you see, the research and everything comes from there. All right, so slide pe hai, lekin what do you think? Why are we here? Because ma'am already said mental health is as important as physical health. We all know that, right? But what do you think it means that suicide is the most preventable form of death? What does that mean? Can you prevent heart attacks? Few things we can do, lifestyle change, this and that, like medication, exercise, right? But can you prevent it?
No.
But cardiac diseases are one of the leading causes of death, right? What do you think it means when we say suicide is the most preventable form of death? You think we can prevent suicide?
Yes.
Yes, no,
Yes.
hungry. Yes, how do you think we can prevent suicide? You're answering, great, but I need to hear it. It'll be very boring if I'm talking and you're listening like that.
By talking with them.
Yes, by talking to them, absolutely. What else?
Motivation.
Moderation?
Motivation.
Okay, right. So we know that, like ma'am said, every few seconds, every minute, there is someone who's at least, if not completing, attempting to end their life. Why do you think people want to end their life? Lot of whispers again. Louder, please. Situations, yes. Lot of problems, lot of stress. What else? No hope, exactly. Loss of hope. What else? It's usually a lot of pain, psychological, emotional pain, and they don't know what to do. And one of the main reasons people experience suicidal thoughts, or what we call suicidal ideation, is because there is severe depression. When someone goes through depression, there is something called a tunnel vision that they develop. What do you think a tunnel vision means? Have you heard of this term, tunnel vision? What do you think it means? Yes. So their ability to look at things objectively and from a wide perspective goes away. Unko sirf ek hi cheez dikhti hai. There is one way out, right? Because the brain is not able to come up with different ways of problem solving, different ways of creative thinking because of the depression. And so they find that this is the only way out. So what I'd like you to know is it comes from a lot of pain. And like you said, if you and I offer hope, that pain can end. At least that pain is shared and they have hope that they can continue. Because with depression, severe depression, there are three things. Hopelessness, worthlessness, what's the third one? Helplessness. ये जब तीन चीजें रहती, then you need to know that this person needs support, right? So we need to make sure we offer that hope, yeah. And we all know that even now, even in 2025, there is stigma around mental health, right? Why are you going to a counselor? Even now, I have my clients saying, I had a 14-year-old girl email me and saying, ma'am, what are your charges? I said, you're 14 years old, don't worry about my charges, but let me know what you'd like support with. She said, I want counseling, but I don't want my parents to know. They are not going to send me. I said, I can't get you into counseling without parents' consent. I can't do that. No, ma'am, I can't. They're not going to allow me. I will pay you the fee from my pocket money, she said. I said, I don't mind doing it for free for a 14-year-old kid, but I need parents' consent. So I had to accumulate resources of people. For example, Roshni has a helpline. So I had to get that helpline information and give it to her. Right? So there is stigma. Parents don't want people to seek help. Log kya kahenge? What will other people think? Shadi kaise hoti? All those things come in the picture. So there is a lot of stigma and fear that keeps other people from talking. Now, for example, if someone comes and tells you, I'm going through a lot of problems, I don't know what to do, I just want to run away, I want to die. If they say those things, what is something you will tell them? Hopefully you'll say, let's get help. Right? But how likely do you think they are going to be to actually seek help? Right? And so we as society, when we say society, who is this entity that we are talking about. Who is society?
Everyone.
Exactly, it's you and me. So if we change how we think about these things, that can create a huge ripple effect. So if anything, after you leave this room, if you are convinced that it is important to receive mental health support, it is important to ask for help, and asking for help is not a sign of weakness. We have been told that, you have to solve your own problems. You are not weak to go talk to psychologists and psychiatrists. That is a myth, and we need to end that, right? So we can become the first line of defense. When any of our friends or community members go through a difficult time, today I'm going to talk about what steps you and I can take. So we'll just know a little bit. So these are 2 slides of statistics. This was in 2005. I want you to just glance through it, okay? Because this next slide will tell you the changes. Okay? 324 a day. Now it is 468 a day. These many people are dying, completing suicide. Okay? And we can do all of these statistics. I'll tell you a little bit later about what this means, but please know that most vulnerable group is 18 to 30 and 30 to 45 females. Alright? So I need you to know, if you have patients, friends, colleagues who are in this age group, and you know that they are going through something difficult, whether it is health related, emotion related, relationship related, they are at risk. So if you see signs that they are not okay, please check on each other. Instagram pe rehta na, don't miss out, check on everybody. It really is important, right? So, and a lot of times the reason why this last slide is important is, it is clubbed as accidents, but we don't know how many were intending to harm themselves by driving rashly or, just walking into the road. We don't know. So this number is not complete. 468 a day is also not, it's more than this. Because till 2016, I think, suicide was a punishable crime. It got decriminalized only recently. So people would not report it. If someone actually attempted and died by suicide, family members or people wouldn't report it because it's a criminal offense. And if someone survives, they would be arrested. So it is a good thing that it is decriminalized so that people can receive support and not have that stigma of getting arrested, right? So let's talk about a few myths. You know what myths are? Manghadan kahaniyan. They are not true, but they are believed to be true. Okay? So suicide in youth is not a problem. It's a myth. Because how many times do we see in the news that someone, a kid completed suicide or died by suicide because they didn't get good marks or there was a relationship that didn't work out? There are so many times it happens. Yes? And it is a leading cause of death in this age group, 15 to 29. And don't look at this slide if it's triggering you. Look at me. So this is just information. Why did I put this slide of what methods? So that you and I are aware that if someone we love is experiencing suicidal thoughts, we have to keep them safe by preventing them getting access to these objects. That is the only reason why this information is there. Okay? Because one of the main things is, if someone wants to or thinks about committing suicide, they will always make their intention known, whether it is by verbally directly saying it or indirectly. And if we know what signs to catch, we can help them at the right time. Because one of you said, it is a lack of hope. And so every time someone is in a position where they are experiencing suicidal thoughts, they usually reach out for help, not directly, in some indirect ways. So if you and I are trained to catch those signs, it's a better thing, we can prevent it. So this is US statistics, because there they have much more lethal methods which men have more access to. So boys will go get a gun, and there is no way you can survive a gunshot, right? For women, they don't use such lethal methods. However, in India, it's a different statistic. In India, females more, are dying by suicide more. Okay? So why is this information important? So that if you see signs in someone you know, you please make sure they don't get access to any of these methods. Yes? So here's what you can say. I'll say point one and then you read, okay? Because when I say read, everyone's getting into a chorus. So point one, please read out loud. You can translate, no? Telugu mein, Hindi mein, whichever language you speak with your friends. But I need you to have this script if you don't know what to say. If you have a pen and paper, note it down. If you want to take a picture of the slide, you can take a picture of the slide. Any questions? Okay. And then the final thing also to appeal is to get them to seek help. This is very important. Okay? So, will you be willing to get help? Can I give you numbers of So, when I was an on-campus counselor in one of the degree colleges in the city, I used to do this training every September. And I would tell them, if you see someone of your friends going through a difficult time and they're not doing well and they're showing some of those signs, unka haath pakad ke counseling room ko leke aao. I would say this to them. And after September, my counseling room used to be full, not 1 minute, khane ke liye bhi time nahi rehta tha. Because I know that young people are very concerned about each other. They would make sure they brought their friends. And I was very happy not having lunch and sitting with them and making sure they're okay. Yeah? So if you offer support, be willing to also encourage them to seek help and check in with them till they get the help they need. Yes? Make sure, let them know. Call me back. If you don't hear from the counselor, we'll try another counselor. Please let them know. Again, this is also appealing again. I want you to live and I'm on your side. We will get through this together. It's very difficult to have to go through the painful situation that they're going through and to do it alone. So if you can offer support and let them know they're not alone, that itself is offering hope. Alright. See if you can get others involved. Don't reveal information to people they don't want you to tell. Tell people who they trust. Okay? So this is one of the last few slides and this is what I would like to tell you, that it's not just psychologists and doctors who should be, doing work around suicide prevention. It's everybody's, each one of our responsibility. Because have you heard this? I am okay if all of us are okay. That there is a principle that says, I'm okay when we are all okay. Okay? So individual health depends on community health. And if we as a community, you as students of this organization or professionals of this organization, create an environment where seeking help is not stigmatized, when mental health conditions are not made fun of. Yeah? You know how we joke, right? She's always sad, she's such a depressed person. Do we know how bad depression can get? We never make fun of that. Right? So if we have this sense of safety and no judging, then we can, even if we tomorrow have a problem, we know that, okay, I won't be judged. So if you don't want to be judged, you don't judge other people when they are going through a difficult time. Yes? What I just said. The culture that encourages seeking help, and suicide is not prevented in hospital or psychologist's office, it is prevented by everybody when we address quality of life concern on a daily basis. Quality of life is not just, roti kapda makan. It is emotional health. It is feeling safe. So these are, the first one is Hyderabad Academy of Psychology. It's not like an emergency contact, but Chetna, Asha, their emergency contacts. Roshni is also suicide, like a mental health helpline. Okay? Hyderabad Academy of Psychology you can contact if you need a counselor. Alright? And one thing I want to give you as homework. How many of you feel okay doing a homework for me? Thank you for all those who raised their hands quickly. I want you to make a list of close by mental health. Of course, you have a psychologist here also. But to give, for example, your friends or clients that come to you for treatment, I want you to make a list of mental health or suicide related help. Helplines, counselors, hospitals, clinics that offer mental health service. Have a list with you at all times so that you can give clients or give your friends, whoever you come in contact with, if they need help, you have a list ready. And if you're giving helpline numbers, make sure you call and check that they are functional, because there are a lot of helplines that are not functional. Okay? So, can I trust you with this homework? Yes. For yourself and for your community. Alright. So, I'm open for questions. I hope I've not taken too much time. I am hungry, I don't know about you guys. but I'm here for questions if you have any questions. So thank you so much for listening to me patiently. I know some of you, it was difficult to hear all of this. I appreciate you being here and listening through. And I know that it was a difficult topic, but I want you to take away that the reason we speak about it is because we can offer hope. You and I can be channels of hope. And together we can protect ourselves, each other. Yes? So this message of hope is what I want you to carry. The sense of responsibility and hope. Alright, thank you very much.
So how did it go? How many of you are feeling good? See, you're learning things wherein you also can put in some effort to find friends, to find people who are undergoing difficult situations. In today's world, with the fast-paced things that are happening, there are so many people whom you don't know are undergoing a lot of stress. And there are people who are not able to come out of their stressful situations and get into all kinds of problems, mental health issues, which at the end, they feel that there is no solution for the problems that they have. Nakem dari kanpinchatledu, nenem cheyali, what should I do? Nowhere, nobody to help me, nobody to talk to me, nobody to do anything for me. This is what keeps on going on in their mind. Because Mundu, we had a lot of people around us where we used to talk. Family and anything, we used to be a joint family system where we had people to talk to and get some kind of help. Now we are living in nuclear families, away from people. Both husband and wife will be working, everybody is on their job. Thought process is always tomorrow morning, what is it that I have to cook? What I have to do? How do I get out of my home, go to office? How do I get back? So none of us have time to look at what the other person is doing, what they are going through also. So this is an eye-opener where we start looking at others, start seeing if there are any signs, warning signs that are telling that this person is undergoing a difficult phase. It may not be a suicidal tendency, but any difficult phase that they are undergoing, if we are able to identify that, so this person is having some problem and needs some help, there is help available. At least talking to you might help them. Okay, so this is what even I wanted to tell, and I thank Bona to give a very good lecture on how to help yourself, how to help others, how to help the community, and how to prevent a big major thing that most people try to do when they are not able to come out of their issues. So, thank you.